Today I wanted to share a little case study with you about a person suffering from neck pain, headaches, dizziness, and a little bit of facial numbness. My name is Dr. Armstrong. I'm a chiropractor at Willowbrook Chiropractic, where we offer chiropractic, registered massage therapy, as well as cold laser or level 4 laser. And the laser in this case is what helps the patient recover. So the patient I'm going to talk about is myself. I started suffering from neck pain that began after swimming, and it kind of came out of nowhere. It progressed to headaches, progressed to some numbness, and then I was getting dizziness as well. So I went and saw my chiropractor, Dr. Freedman, and it was helpful but not quite solving it completely. Went to the massage therapist, Clayton, and he reminded me of the referral pattern of the SCM muscle at the front, which can sometimes give a sensation into the face. So that was comforting to know we found the source of that facial numbness. So I started going regularly to chiropractic and massage, made some lifestyle changes like we would advise all of our patients. So I changed my pillow. I looked at the way I was swimming, changed that. My computer setup and how I was driving, started using my reading glasses a little bit more so that I wasn't peering forward at the computer. And I was still having these headaches returning. Then it occurred to me that this is the perfect case for laser. So we find that laser can be really effective in these chronic cases that just aren't resolving, because sometimes that tells us that there is either an inflammatory element to it or a nervous system irritation, where the nerves are just chronically irritated and just not calming them down. And the laser is excellent at calming it down. So we use this infrared and red light to penetrate deeper into the tissues and decrease the irritation to the nerves and decrease inflammation in the whole area. So after my first visit to laser, I found a little bit of relief for that day, and then it slowly returned. My second visit, that relief lasted longer. And then when we got into visits 3 through 6, which is when we usually ramp up the intensity of the laser, I really started to see the benefits. It was lasting for longer. If I did get a headache, the intensity of it was very low grade. And then I found after I completed 6 to 8 sessions, then I was able to go a month or more without those issues returning. So I still do all the things that I know that I need to do, my stretching, my foam rolling, and that keeps things at bay. And if I ever feel like that irritation is creeping back, then I do a maintenance visit for laser. But it really is what made the biggest difference in my case, because I was still kind of suffering on and off for about a year with this neck pain and headaches before it occurred to me to go across the hall and get some laser therapy. Now, of course, we have lots of videos about how to stretch and strengthen your neck and shoulder pain. Also videos about how we approach neck pain from a chiropractic perspective, and also about laser therapy. But if you have any questions about what I've talked about here today and want to learn more about laser, please feel free to ask myself, Dr. Armstrong, or Dr. Jody Freedman. And you can book online for chiropractic or a laser assessment at willowbrookchiropractic.com.